Well, welcome to Friends Talk Money. Today we have a very special program for you because if you're 65 or older, you've heard it's out there that we are in the moment of Medicare Open Enrollment, which lasts through December 7th, and where you have to make some very important decisions. And please don't say, well, I'm just fine. I like what I've got. I don't want to change anything. If you don't review some of the important key ingredients in your Medicare coverage, you could be in for an expensive and very painful shock next year, not because you want to change something, but because stuff is changing behind the scenes. I hope that got your attention. We have a very special guest today to make sure you're getting the absolute best information. We've invited Diane Omdahl, who created her website, 65incorporated.com, more than a decade ago, to guide seniors in their Medicare choices. Now, Diane is nationally recognized as the expert in Medicare. She's the author of the best-selling Medicare for You. And I want to say this up front as I introduce you, Diane. Diane charges a consulting fee for her services, her people do. But Diane and 65incorporated.com do not sell any policies, nor do they get referral fees from insurance companies. So you're getting not only expert, but independent advice from Diane. Diane, let me just welcome you in for the start. Did my intro do you justice? Does that what you do? Explain what you do for people.
Basically, I help people make smart Medicare decisions. And I help people later on deal with the decisions if they did not know what they were doing initially. And that is, it can be heartbreaking at times, but we are trying to get the word out so that people, particularly now, like you said, if they don't pay attention, they'll be calling me in January very upset.
Right now, before we get started, and we all have lots of questions, let me explain that I want to kind of divide this podcast today into three sections. First, we want to talk about what is open enrollment, what can you do, what can you change. Next, I think now that we've got Diane, we need to cover this big thing that's going on about traditional Medicare plus a supplement plus a Part D drug versus Advantage. I started writing about this years ago, and now, of course, it's making headlines. So we're going to get deeply into that. And then something critically important, so stay for the end, is Part D drug plans, which is something that absolutely every senior must review. So before we get going on our questions, Diane, explain what open enrollment is about. It's not the only time you can do something with Medicare, but it's a big time.
Well, I think open enrollment is the annual opportunity to tune up your Medicare coverage and make sure that it is effective for you. This open enrollment period started October 15th and it goes to December 7th, so it is not a very long time. We encourage people to pay attention early on in case they find out that they have problems, and then they have the opportunity to investigate options that will work for them next year. If they do not make important changes before December 7th with their Part D drug plan, they will start January and realize, oh no, I didn't pay attention and now I'm paying way more or my medication isn't covered. So during open enrollment, the important things that they can do first and foremost is to review their current Part D drug plan and make a change if necessary. Find out what it's going to cost you next year. Find out whether your medications are all covered and you can stick to the pharmacies that you have. It's also the time to change your Medicare, review your Medicare Advantage plan, but you have a 3-month window next year, and it may be to your benefit to wait. But anyway, you've got the 2 for Medicare Advantage. If you have not yet enrolled in a Part D plan or you're new to Medicare, this is the time that you can enroll in a Part D plan. Likewise, you can enroll in a Medicare Advantage plan. You can choose to drop your Part D coverage, which would leave you greatly exposed if you don't do something. But anyway, you can do that. And you can drop Part D and enroll in Medicare Advantage, which Terry said we're going to discuss the pluses and minuses of that. And you can drop your Medicare Advantage plan and enroll in a Part D plan. Now, your ability to get a Medicare supplement then will depend upon your health and where you live. So these are the things that can be done during open enrollment.
Now, this is huge. Let me say right here that with Diane's help, I've posted a long 3-part special report called Medicare Beware. We'll link to it in our show notes, and it is up on the homepage at terrysavage.com. And I also have an Ask Terry blog where if you ask me something about Medicare that I don't know, you can be sure I'm on the phone with Diane. So this is a big topic. Don't get overwhelmed. Just to start out, Richard, some thoughts about how we're approaching this whole topic of Medicare open enrollment?
Sure, thank you, and great to see you, Diane. I've seen two surveys recently. One said that 75% of people on Medicare find Medicare confusing. I think that makes
Only
I'm not too
75%.
surprised.
Only
Yeah, it could have been
75.
higher. But also 69% of people who have Medicare say they do not compare Medicare plans
Nope.
every year, and they didn't do it last year, and that is really a big mistake. I guess the first question I have for Diane is, what makes this year's open enrollment different than last year's? Are there one or two things that you think are especially important these days? And then maybe just a brief explanation of what Medicare Advantage is compared to what traditional Medicare is. I know we'll get into details, but you've mentioned Medicare Advantage a few times, and people see the commercials, but I'm not sure everybody knows what that means.
Okay, well, first let's deal with what makes this open enrollment so different. The number one thing that we're finding is that Anthem standalone Part D plans have quit. They are pulling out of every state that they were in, and that's a fair number in double digits. Here where I live, 2 Anthem plans are going away. Now, people who have an Anthem Part D drug plan, not Medicare Advantage, Part D drug plan, if they do not pick a new plan by December 7th, they will not have drug coverage come January. And let me tell you, I heard probably from about 50% of those 69% who don't pay attention in January. I think another significant difference is that the premiums have just gone screwy. It used to be that if you had a United Healthcare drug plan and it went up in California, it was going to go up in Wisconsin and go up in Florida. Well, that's not true this year. Where I live, 8 of the 10 plans we still have left are dropping premiums, where in Los Angeles, 8 of the 12 plans out there are increasing premiums. So pay attention. You may be able to find a better premium. Now, another significant change is that the formularies are changing. The plans are becoming less
What's a
likely to.
formula? What's a
All right,
formulary?
that's a good question. Formulary is the
Wait,
list of
Diane?
drugs. Yes,
Time out. I want to
time
just
out.
a little
Okay.
sidebar. Terry Savage, Medicare 101. So everybody starts out even before we get deep into this. Half the country is still on traditional Medicare. It lets you see whatever doctor or hospital accepts Medicare, and all of them do. Medicare pays for a lot, but it has an annual deductible and it has co-payments. So people who are on traditional Medicare, half the country is on traditional Medicare, typically buy a supplement. And the most comprehensive supplement you can buy now is Plan G. It's offered by many companies. You can buy supplements that cost less and cover less. But the idea is if you could afford it, you'd like traditional Medicare. Part A is free. Part B, the premium's taken out of your Social Security. And the premium for it depends on your income. We can come back to that. But it comes right out of your Social Security deposit. And then you sign up for a supplement with an insurance company that covers just about most of what Medicare doesn't. Except for one thing, with traditional Medicare, you need Part D. Now, it's not a hard and fast rule that you must have it. Part D is for drugs. And a lot of people, me too, when you sign up for Medicare at age 65, you say, hey, all I take is Tylenol or maybe an Aleve. But I promise you that at some point down the road, you're going to take a blood pressure or a statin or something like that. And if you don't sign up for Part D, even though you're not taking drugs, that monthly cost is going to go up. It's a penalty cost. So there are a lot of plans for Part D that actually have a 0 monthly premium. So you're not paying for anything, but you should sign up. That's traditional Medicare. A, B, and D for drugs and a supplement. Then there's Medicare Advantage. I'm just giving you Medicare 101. Medicare Advantage works perfectly for your regular checkups, and you get a teeth cleaning once a year. But you will find out if you get sick that your choices may be limited, very limited. So why is that? By the way, these are public companies, these insurance companies, you've seen them. They get paid by the government a certain amount per capita, and they make money when, all told, all the people they cover use less than they get paid in healthcare than they get paid from the government. Well, they've been getting squeezed. The profits have dropped, And they've started saying, no, you can't have that service. No. And by the way, a lot of doctors and hospitals, Diane will verify this, are dropping out of participating because they don't like the hassle of trying to get things approved either. So there's your 101 on Medicare. Richard, now I'm going to turn it over to you because you had a really good question, but I think we all need the ground rules.
Before we get into any of the details, one question I had here, Diane, is some people think that, well, maybe they should hire a Medicare agent or broker to help them to make a decision about which plans to be in and whether it be in Medicare Advantage or traditional Medicare. What's your advice for people about using an agent and a broker and choosing one if they want one?
We have helped people identify a good broker, and one of the questions that they would ask is basically, how many plans do you sell from different insurance companies? All right. What does this agent say about how many people they've put into Medicare Advantage versus how many people they put into a Medicare plan, supplement plan, right? Those become important questions. If an agent only sells two companies' plans, the best plan that agent has to sell to you is one of those two companies, and it may be company number 3 that is the best option for you. So working with an agent, you need to be aware of what you want before you go, because they could talk you into something else. What is happening in this open enrollment is so many of the companies now are cutting back on their commissions. So the agents who have helped you may not be getting paid to help you with those plans either. So agents sometimes present an option. Now, I have an agent for my plans because I knew what I wanted and I knew what to ask the agent. And the agents can offer help when you get stuck with a claim or something, for instance. They know who to call. So there's know how to pick a good agent and go to one that will work with you once you've done your homework.
I have an agent too, and I'll tell you that he said to me just last week, the insurance companies that he has sold Part D plans in the past, and Medicare Advantage, though I don't use that, are not paying him a commission this year. So he can help guide me, but I can't buy it through him, but more importantly, he won't get paid for it. He also can't help me if I have a problem. I have to do it myself. So people
Sure, yes,
may be
yes.
on their own, or if they get a recommendation from an agent, as you say, it might not be the best plan. It may be the plan that's paying that agent.
Okay, Pam, I know you don't like being called our baby, but what's your question?
I do like being called your baby. I
Okay.
also like the fact that we have not one, two, we have 3 experts, nationally renowned experts on Medicare in this podcast. So believe me, my role is to kind of be the audience. So looking at these Advantage plans compared to traditional, Diane, I think a lot of people, I've heard Terry say it in previous podcasts many times, when they hear it on TV, all of the ads about dental, vision, hearing, all for less money. But what are the hidden trade-offs that people often don't realize until they actually need the care? For instance, what happens when somebody needs a specialist, or they need a second opinion, or they suddenly find that they're in a very narrow network?
Briefly, there are 3 big differences. Number one, it's already been alluded to, and that is the networks. Plans work with networks, so you have to find a doctor in network. Now, here in my community, the big to-do the last 2 weeks is that Ascension went out of the United Healthcare Network, and I had people in my church call me like crazy because these are their doctors and they're losing their doctors, and that is happening all over. I believe Terry wanted me to confirm that health systems are dropping out left and right. I think the last number I read was like 38, leaving thousands, 26,000 here, 10,000 there, suddenly left with no doctors. And depending on the timing, if it is not open enrollment and it hasn't been deemed to be a significant change, they're stuck till the end of the year. Okay, networks. Cost. You don't pay a premium up front, but it's a pay as you go. And the out-of-pocket cost, you keep paying till you hit the limit. And next year, that limit is going to be $9,300 for in-network services. So if you get cancer and you have to pay 20% of your treatments, you're going to hit that 9,300. And then, so all of a sudden the premiums and the pay now of supplement look very good. I pay my premium, I meet my deductible, no more costs for the rest of the year. So cost. And the third one is the fact that prior authorization, as Terry alluded to, everything in a plan, MRIs, X-rays, blood tests, skilled nursing facility rehab, PT, everything is prior auth, which can mean a delay if you can even get it, all right? So those are the three roadblocks that they don't hit until they're older. And then the whole thing about, hey, I want out now. I don't want this care anymore. I want to go to a supplement. And Terry mentioned the secret that I wish I had known. I hear that so much. Your ability to get a Medicare supplement depends on where you live, more importantly, what your health is like. You do not have a guaranteed issue right, which means without a guaranteed issue right, the insurance company can look at your medical history. So if you had cancer in the last 2 years or you had a heart attack, you will not get a supplement because the insurance company applies medical underwriting. And that is what people say. Nobody ever told me that. Now I'm stuck. And we get to look for an advantage plan that may work better. And you do
Now,
not
wait,
want to be on the phone then with these people.
though there is one guaranteed issue though. Within 6 months of
That's
originally
initially.
signing up for Medicare, traditional Medicare,
Yes.
Part B and A and B, you are guaranteed no matter what your health
Yes.
is
Yes.
to get
And
the best supplement.
yes.
But that's the thing. You gave it up. You went to Advantage and now you
Yes.
want to go back. Oh, sorry, you've got a pre-existing condition. Remember that from the olden
Right.
days?
Yes.
And you won't get the supplement. Oh, you will if you go back, get your choice of doctors. Maybe that's more important, but you're going to pay a lot of money.
Yes.
Can I
But
ask
that 6 months is important when you first get Part B. Very important.
Oh, Diane, do the point that you wrote a big national article about. Someone called me about this week or posted on my blog. If you leave your company and you decide that you love their insurance so much that you're going to take Cobra, Cobra can last 8 months.
18.
But if you get past that 6-month period, you're past
18.
the 6-month
18 months, right?
issue for supplement.
18. Yes.
I'm sorry,
Well,
18 months. I'm sorry, that's 18 months. But you say, oh, I love my corporate insurance, but you left your job at age 65 or even 67 and lost your coverage and you got Cobra. You still had to sign up if you want traditional Medicare and a supplement within 6 months of losing your job. I know you made a big point of that in an article.
with Cobra, the big problem is signing up for Part B initially. If you miss the window, then you're facing a penalty. But if you are in Part B with Cobra, as you should be, you have that 6-month window initially. So if you're paid Cobra, the danger about paid Cobra is they pay for 12 months. And there you are. You're stuck. Now if you ride Cobra to the end, 18 months, and Cobra kicks you out, then you got a guaranteed issue right. So you have to go within the first 6 months or the full 18 months. But if the company pays 12 months and you go for that, you're in no man's land. It's all very complicated. Okay,
Can I go
Richard?
back to prior authorization for a second? So,
Yes.
because one of the other big changes for this open enrollment for 2026 is that for the first time, some people with traditional Medicare are going to be subject to federally required prior authorization. Now, it's only in 6 states. I'll mention them. They are Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. But
Right.
if you live in one of those 6 states and you need one of 17 types of treatments, and they're laid out by the government, and you're in traditional Medicare, they are going to require you to get prior authorization. And that's a big change. I wonder if there's anything you want to say about that, Diane.
I definitely will speak to that because I've read that Congress is trying to stop the funding for it. Everybody is upset because it's going to turn original Medicare into a clone of Advantage, delay and deny. However, I am in a different camp. All right. What the government is doing with this project is that they are tackling the codes that are subject to fraud. In that list is the use of skin substitutes, which is man-made materials to help heal chronic wounds that don't heal. One couple in Texas billed fraudulently $1.2 billion. It's like nobody's paying attention to what they're paying for, and that's what this project is doing. The other target is the services that are low value, high risk for people like joint injections, okay? They are submitting them to prior authorization, first off, to verify that it isn't going to be fraud, and second, that it is going to help the patient. All right. I happen to have a procedure on that list that I could not get up every morning if I didn't have it. So if it ever hits Wisconsin, it will be prior auth, and I go for it because you're going to control what's going on. Second, the project is voluntary, which means that doctors don't have to participate, and then it will go through the normal channel. Third, the biggest difference is that these are not going to be denials. They are going to be non-affirmations of the request, which means that the doctor can simply submit it with more information. So in my case, the doctor might submit some x-rays, okay? It's not a denial. I don't have to appeal. And I think that is a big difference. Fourth, they're going to test the use of artificial intelligence. Medicare Advantage plans have no method, no method to their madness. And so it's just on everything. And they're using AI and we have no idea. So I see it as it's a 6-year trial period, trying to put some sanity to the use of AI, trying to put some organization and standardization to prior authorization, and trying to control and rein in what Medicare is paying for. With the amount of fraud, we could extend the Medicare Trust Fund, who knows for how long. And so I'm in a different camp. And I probably because I've worked with Medicare for 40 years and I have seen when when the fence is broken and the cows escape, there's no getting it back.
All
And
right.
they're
Well, all I
trying.
can say is I live in New Jersey. That's one of the 6 states.
Yes.
And if I need treatments for pain management, that's going to be subject to prior authorization. I'm hoping I won't need that. And I'm concerned if I do, it may be something of a nightmare to just get the treatment I need. But I hope you're right. It
Well,
won't be so bad.
well, I think I'm going to be paying attention to it and I'm going to see how this goes. But the government has tackled some of this before and they have the resources, both dollars and technology and the ability to tell people what to do. That should make a difference, Richard. So, if it
Okay.
ever comes to Wisconsin, I know that
All
two of the
right.
procedures, I'm going to be right there with you, man.
We'll see.
Okay. Diane, can I just get one question about
Yes,
we're talking about the options, open enrollment. Let me
sure.
ask this from a consumer's point of view. So if somebody, just for clarification, if somebody does start out in an Advantage plan and then later wants to switch back to traditional Medicare because they're not getting access or the care that they expected, what is the real life hurdle that they face with getting a good supplement plan at that point? Are there any states that make the switch easier to do that?
Well, there are 3 states that have requirements. There's no medical underwriting. So they basically can switch whenever they want. Like New York is one of those states, but you compare the cost of the compare the premiums in that state to other states, and they're easily 50, 100, $150 a month more because everybody's starting on Medicare Advantage and they're switching when the wheels start to fall off. All right. Beyond that, getting a supplement initially, you face the underwriting hurdle. All right. Now, in some states, once you're in a supplement, they have birthday rules that you can change the supplements, but that's a different situation. I also want to bring up the fact, Pam, you said like when you get into Medicare Advantage, if you opt in at 65, you have a 12-month trial period to test it out. So anytime from age 65 to the month before, you're 12 months later, you can try it out. And if it doesn't work, you go back to a supplement.
I
Right?
see. That's good to know.
Then if you start out with a supplement and you get hooked in by a commercial or
Yeah,
you get switched unknowingly through calling the number, you have a 12-month window to try the Advantage plan and go back. So if somebody age
they don't
70,
tell you that though, do they?
no, they don't tell you that.
And get
But
your supplement back.
I write about it. I try.
And you can get your supplement back.
Yes. If
And
it's
that,
still sold in your market, and if it's not, you can buy any supplement.
okay. Now, I want to move on to part D, but I want to make sure anybody have any questions left. I'm thinking of all of
Yeah.
you out there listening.
I have one more Medicare Advantage question. I think some people may be confused about if they choose Medicare Advantage, does it necessarily mean that they can't see any doctor except certain doctors in network? Because I think there are certain Medicare Advantage plans that they say, well, you can go out of network, but you'll pay more. And then others say, no, you can't go out of network. So can you explain that?
All right. Medicare Advantage, the two most popular plans are a health maintenance organization, an HMO, and a preferred provider organization, a PPO. Now, there are fewer PPOs than there used to be, but anyway, an HMO basically will lock you into a network for non-emergency care. All right. So all your doctors for your routine, like your blood pressure checks and your blood test and your PT, whatever, you have to be in a network that the plan has listed those doctors. The PPO plans, their best cost will be in network. So they all have networks, but you have the freedom and the flexibility to find doctors elsewhere. So if you live in Wisconsin and travel to Los Angeles and something happens, you could look for a doctor who will take your PPO plan. Now, two hangups with that. As you mentioned, the costs are higher. Hospitalization can be 50% of the cost for a PPO out of network. The second hangup is you might choose this doctor in Los Angeles, but that doctor does not have to see you. It is written in the fine print. There are no obligations for out-of-network doctors to see out-of-network patients. It's up
Wow.
to the provider who agrees to bill your plan. So those are the two big hiccups with out-of-network for Advantage plans.
Thank you.
And by the way, let's talk about that portability. When you have traditional Medicare, you live in Chicago and you go down to Florida for the winter, the doctors down there will take even if your supplement is in Chicago.
Yes.
I mean, that's your address.
Yes.
But okay, or you're in New York, but you're out in California and you're hospitalized.
Yeah.
It's going to be covered in full. I mean, and your supplement will cover you wherever you go in the United States. Talk about a country.
And there's an important point here, because when we're talking with clients, for instance, and they're saying, well, I want to get, let's say the Gerber Medicare supplement plan, and Gerber does have one, right? Anyway, my doctor said, though, they don't deal with Gerber. Well, it's irrelevant what the name of the supplement is. It could Gerber State Farm, it could be ARP, it could be Blue Cross. The name is irrelevant, because what happens if the doctor accepts Medicare, the doctor bills the Part A or the Part B for what's covered. Then there's an automatic crossover, meaning that whatever Medicare doesn't pay automatically crosses over to your supplement without regard to the name. And the supplement will pay what it's supposed to pay. And if there's, like with the Part B deductible, it dribbles over to you if you have anything to pay. So the name of the supplement, it could be, Johnny Schmo Supplement Company. It still will work. And it's not network based. And so doctors, they take Medicare, they take your supplement.
It's a good point to know.
Traditional Medicare.
Yes.
Traditional Medicare Part A, Part B, your drugs, which you could get your drugs if you go to CVS in Florida or Oklahoma or Walgreens or whatever. You hope your pharmacy might be everywhere so that you could pick it up somewhere if you're traveling. But the most important thing is the supplement follows you along with your Medicare.
Yes.
You can go anywhere.
True.
Okay.
Mm-hmm.
Okay. Now, did I miss anything so far about Advantage versus traditional? I think before we leave that, I just think it's so important, because those commercials are paid for by the profits on the healthcare. They don't give you, because the more people they get into Advantage, the more reimbursement they get from the government. So they can offer this low or no premiums or da-da-da-da-da, but they make it up in some way. They're supposed to be looking at the odds. Okay, we can take care of a lot more people, but you're not going to get the care.
Yeah. I'm just going to just make the statement. You guys tell me, is this fair or not fair to say that paying a little more upfront or paying more upfront for traditional Medicare actually seems like it saves money over the long run and a lot of stress over the long run? And that's something that, Terry, I know you've been saying.
Yes,
Well,
but you go ahead and do the but. There's just people that can't afford it.
Well, here is the thing, all right? If they cannot afford the premiums, they cannot afford to get sick with Medicare Advantage. If we say your monthly premium for a supplement is $300, which I haven't seen a $300 premium, right? Except in very rare cases. $300 a month times 12 is $3,600, plus the Part B deductible, $257. So that's $3,857 for original Medicare, the complete package, no out-of-pocket costs. I mentioned just a bit ago that the out-of-pocket maximum is $9,300. In Wisconsin here, we're somewhere around $5,000. All right. Down in Florida, you're going to get close to the $8,000
for Advantage plans.
for Advantage. So
Yeah, by the way,
If
you've got
I
10 days.
get,
Yes.
yep, if I get sick, if I get cancer and have to pay 20% of radiation treatments, I'm going to hit that out-of-pocket maximum. So in Wisconsin, 5,500 compared to 3,600. It costs more upfront, but if you get sick, it will be a cost savings, as Pam said. And if you can't afford the premium, then you better stay away from black cats and ladders when you have Advantage.
But
Yeah.
one thing I would say to Pam, though, is that there are some people who say, well, I want Medicare Advantage because I want to get some dental coverage. I want to get some
Oh,
vision
Richard,
coverage. I want to get
Oh, don't
some
get me started,
I want to get
Richard.
some hearing coverage, and I can't get any of those with traditional Medicare.
Let me tell you with the dental, the plans
Yeah.
premiums are zero, but you're locked into a network. And I have seen over the last couple of years a major change. You get free prophylaxis and x-rays, but you want a crown, you want a filling. Most of these plans now are charging 35 to 50% coinsurance. A comparable option is a dental savings plan, okay? I can speak from experience. My dental savings plan is $99 a year. My first visit for my basic cleaning and x-rays, I saved $71, all right? So I've got $28 that hopefully I'll cover next week when I see the dentist. So I don't need to go to Medicare Advantage for dental. Vision plans, I studied in prep for this, some of the plans now, and most of the plans will cover $300 in glasses every other year. So you switch to Advantage, you take all the risks for $150 a year. Do you want the left side or the right side of your glasses? Gym memberships, they cover that.
Yeah.
But as a man told me,
Yeah.
he was in a car accident and trying to get rehab. He says, what good is my gym membership if I can't get rehab?
Yep.
So it's these things that people don't do their homework
Yeah.
and realize.
My mom always said, she really did. She'd always say, the big print gives it to you and the
Yeah.
little print takes it right back.
And
All right.
trying to
Okay.
find that little print is painful.
It is. And you don't know what questions, yes. That's what we're doing this podcast right now. I want to save a hunk of time here because this is critical. Even if you think, okay, I'm glad I've stuck with original Medicare. There's no need to review your supplement every year. I mean, because it stays the same. But if you're even on traditional Medicare or you get drugs inside your Medicare Advantage plan, and this is the only time you could change your Advantage plan, here's what you need to know about Part D drug coverage. As I said, you should sign up initially, even, and there are plenty of zero premium plans. But somewhere along the line, you're going to wind up with prescriptions, a statin, a blood pressure, a something or other, or worse, God forbid. This is the time when you must review your plan last year, even though you had no hassles, you went to the pharmacy or they came by mail order and everything was fine. Because every year, the insurance plans for Part D change. That's the big word I interrupted before, formularies, what drugs they cover, what tiers they're in, what drugs they won't cover at all. Now, I will start with this. Part D gives you for 2026, it'll be a $2,100 cap on out-of-pocket expenses for prescription drugs that are covered by the plan. This doesn't include the monthly premium, doesn't include the deductible, and if you get prescribed something in the middle of the year that the drug company doesn't cover, you're stuck, you're out of pocket. Diane, oh, and the big headline news for this year. You want some help? Sorry, the insurance companies are no longer paying brokers to help you decide. So the first place you would go would be to Medicare.gov. You have an account there, sign in. And it astoundingly, it not only remembers what prescriptions you had last year when you signed up, it also remembers every prescription you had filled this year. You had an antibiotic for 10 days, you're not putting that on your drug plan, but you got an added prescription. It says, do you want to add this? And then you can click and compare. But that's tough to do. So I want to tee you up, Diane. Diane Amdahl created something, a separate company. Write this down. Hey Mo, Hey, Hey, MOE is Medicare Open Enrollment. HeyMo.com. Diane, explain what heymo.com does that you can't get anywhere else in terms of helping you search for Medicare Part D drug plans.
I think the one thing that it does is it's a reminder service. We have clients who we work with in April or May, and they're concerned they're going to remember. We say, sign up for Hey Mo, put your drugs in now. We'll send you the report later on. You don't even have to pay attention to open enrollment because Hey Mo will take care of you. Second, it is a review service. We look just like Medicare.gov. We'll find a plan that covers all your drugs and a plan that has your pharmacy and network. But we look at 15 pharmacies compared to the 5 in Medicare.gov. So we may find a plan that is the better option for you because of the pharmacy. And that's very important this year. I've already found that out. Anyway, when we look at all of this, then you will get your report that says we do the interpreting too. I forgot to say that. We have some things in there that people who are on levothyroxine, for instance, a generic medication for thyroid disease, they often will list a capsule instead of a tablet, and a capsule is not covered. So in Medicare.gov, they'll find out their drug isn't covered. Oh no, what do I do? Well, change it to a tablet. We have things in there like with Restasis eye drops. If people are trying to save money and will do 1 drop a day, excuse me, instead of 2, and so they're getting it every 2 months, it's not covered. Then there are cases where, excuse me, the generic is cheaper than the brand, and we will suggest change this brand because we have compiled out of my brain and Melinda's brain all of these different things, and we're constantly adding. The report then will interpret for you, like if you change this to that, you'll save this. Or if you change pharmacies from this one to that one, you'll change this. And people can pick and choose. We have built in this to our system. If your drug is not covered, we have a connection to GoodRx that will recommend a coupon because if no plan covers a drug, what are you going to do, right? And we have humans reviewing all of this. We have ticklers built in for these particular, we got to pay attention to this because this is a red flag. And so it's constantly evolving and it's just become, yeah, I am a little surprised at it too.
Okay, let me back up and say it's called Hey Mo. Hey, like hey you, Hey Mo. HEYMOE, MedicareOpenEnrollment.com. It costs $30 a year. And I think this is the big difference. I've written about this part of my series at terrysavage.com because I went through to do my drugs. By the way, we're going to talk, Richard, don't forget to ask your question about timing later because you might want to wait just a little bit, even though we're in the middle of open enrollment. Because the formularies are so confusing. And because when you get to the point where you might reach that $2,100 cap, I fooled around and just put some drugs in there to see what would happen. And the price of one goes down, but the price of the other goes up. And you could reach the cap. I mean, if you have expensive drugs, you could reach the cap in January and February. So to get the guidance of how about generics, how about a coupon, how about GoodRx, and don't even put it on your plan. So basically, I think, Diane, am I correct? You're judging on the total out-of-pocket cost if you go to Medicare.gov.
Total out-of-pocket cost is the big driver. And then all those other things can affect that. Like, Richard had a query to me about preferred versus in-network pharmacies. Now, preferred pharmacies have negotiated with the drug plans to get better costs. But that we're seeing is not always the case. I just did a company with a client with a preferred pharmacy of $2,100, hit the cap. But if that person went to an in-network, his costs were going to be $1,000. An in-network instead of a preferred. So there's no guarantees.
Yeah.
And that's what we look for.
But Diane, I have a question. Couples.
Yes.
Who are both on Medicare. Any advantage or cost savings in choosing the same Part D drug plan, or should each individual
it's
the best for them?
The same drug plan only if your spouse is a clone of you, but there's no cost savings. The one place where you can save with original Medicare is with a Medicare supplement plan if it has a household discount, which means 2 people in the same household. It's the politically correct name for couples, I say. Two people in the same household are on the same supplement. It can range from 3 to 10%, but again, those percentages are dropping, but still 3% for both of you could be significant.
Okay, and then just one more quick clarification for me. You said 2,100 is the cap for next year?
Yes.
Okay.
This year it's 2,000.
Okay.
The cap is adjusted based on inflation every year.
You know, in the olden days, there was the donut hole and the catastrophic, and there was a point where you could be paying thousands and thousands.
Yes.
Here's the quick thing that you need to know is there are two things to keep in mind. If you're just taking a few little generics, you can go online to Medicare.gov, and you know, when every time you go to the pharmacy, it's going to be $3.82 or something like that. But if you're taking a bunch of drugs or the drugs that are considered more expensive, higher tier drugs, you need to go through this and get some help. And that's why I love HeyMo.com. I get nothing out of that, by the way. I'm just madly in love.
Thank you, Terry.
Okay.
Yes.
Okay.
Cool.
But the other thing is that now you're going to pick a plan in December by December 7th. And if in January you suddenly get prescribed XYZ expensive thing, and it is not covered by your plan. Now, it might be in your plan, or a generic version of it might be in your plan. And you can call your Part D provider and say, I can't take the generic. People have done that. I wrote something about it because they're allergic to the way they formulate whatever something that's in the formulary. So we can't take the generic. Can I get the brand? And sometimes they'll make an exception. But if the drug you get prescribed in the middle of the year isn't covered, you're going to pay for that out of pocket all year. Nothing you can.
Yep, there's something you can do.
Tell me.
Yes, you can request a formulary exception.
Yes. Okay.
Your doctor has to submit the paperwork on why no covered medication would work. Now, that formulary exception would carry you until open enrollment, the end of the year, when you need to find a plan that would cover it. And if there's no plan that covers it next year, well, then you start over. Never run into that yet, though, with what's happening. I bet you shouldn't have said that out loud.
Okay, Diane, what percentage of people, just as a guess, because you see all of this, are going to make a mistake by not reviewing their Part D drug coverage? They love their supplement. They're not changing. They're glad they're on original Medicare. They're so glad they can afford it. And but what percent are going to be shocked or make an expensive mistake if they don't review their Part D?
I can tell you from 65 Incorporated's perspective, we ask on our form for open enrollment, not HeyMo, when was the last time you reviewed your drug coverage? Well, if it was not last year, I predict we're going to save them money and we look like geniuses. We have saved people $10,000, $20,000 who did not change their drug plans in several years. And it's basically just looking for a different one. People who do not take those expensive medications, if they haven't changed, years ago, the cheapest drug plans were like $15 or $20. Now, in the intervening years, premiums have dropped down to 0 to 5 to 10. So even those people who take generics or no drugs are paying $20 or $30 a month. We will save them money by finding a lower premium plan. And oh, they're so grateful.
One more quick, 0 drug premiums on Part D. I've explained to people, people still write me, how can they have a 0 premium on my drug plan?
They can have a 0 premium on their drug plan because they charge the maximum deductible. And I am finding that their formularies are more limited. The 0 premium drug plans do not treat expensive drugs very well at all. So 0 premium is great if you take the generics, the common generics. But if you get up into a more expensive drug, what we call the tier 3 or the tier 4, don't go with a 0 premium plan because they will not treat it well, because they're very limited to people who take those cheap or no medications.
They get reimbursed by the government.
Sure.
Well, they've negotiated their cost on their medications. Yes.
I
So Richard, you had one more question.
Well, yeah. Well, I want to make one point, and I actually had 2 questions, but I want to just throw in a personal experience thing that our audience might be interested to hear. To Diane's point that every person is different, every plan is different, and it depends where you live. I had a Part D plan in 2025 that was working for me. It had a monthly premium of about $2 a month. I just got the information for next year. The same plan is going to have a monthly premium of $27 a month. Same plan. So I'm shopping around even more than I would
Well,
have been
and
before.
I have a client whose monthly premium last year was $25. His same plan will be $4 now. So that comment I
Yep.
made before about they're crazy and there's no method to their
Right.
madness.
Yeah.
Okay, so
Now, what?
the lesson is this is the one time and the one area where doing nothing actually costs you the most.
Yes.
Yeah. Now,
Exactly.
one other change for 2026 is that it's the time when, for the first time, the government's price negotiation program for Medicare drugs is starting to kick in, and there are going to be 10 drugs, things like blood thinners, diabetes drugs, a few others, that if you happen to be on those, because they're very expensive drugs, but they're also very popular drugs, you may find the prices of those medications will be lower next year than they were this year. The two questions I had for you, Diane, one is, can you say anything about the Medicare prescription payment plan that is optional but lets some people smooth out their costs so they're not stuck with huge prescription drug costs in the first few months of the year before they reach that $2,100 cap? That's the first question, and I'll give you one more after that.
Okay, the MPPP or the M3P, as some people call it, is like an old installment payment plan at a department store. I
Okay.
have a $2,100 bill in January and I can't handle it. So they will break that down into monthly segments of about $150 or something like that. Okay. And instead of paying for my prescription when I go to the pharmacy, the drug plan will send me a bill every month. So that's one of the big changes. Now, this plan will work for people who get hit with the cap in January or February, right? Now, if you have cost of 1,300 or 1,500 or 500, what happens is that your costs in the MPP will be, kind of up there at the beginning, but then they can dip very low for the next few months. Then in the last 6 or so months of the year, these costs creep up. And what ends up happening is your payment in December is bigger than your payment was in January, which is not what you want when you're planning for the holidays.
Huh.
So if you're not going to hit the cap, my recommendation is just pay for the drugs at the pharmacy because you'll be paying about the same every month instead of having this
Yep.
start relatively low and then dip lower and then go up higher at the end of the year.
Yep.
So
Okay.
that is how that works.
Okay. The last question I had is this morning I saw a piece by another Medicare expert, and he was recommending that people wait as long as possible to make their choices for Medicare open enrollment for 2026 because he said things are going to change. We don't know some information right now. There's no benefit to signing up on October 21st when you can still do it on December 21st. I'm wondering if you have any thoughts about that. It seems to me that if you wait pretty late in the game, it may be hard to get an agent on the phone or a ship agent or the government to answer questions you have. And I wonder what your view is about when to actually make your choices.
I recommend strongly that people look right now. Look to see if their drugs are covered. I give a quick example. A Parkinson's patient I've been dealing with for 10 years takes a bladder relaxant medication that she's been on for 8 years. Well, no plan covered it last year. She talked to me on the 15th of October, and I looked and couldn't find a plan that covered it, which meant she had to start a new medication. So I found some drugs in the same category. She took it to her doc. She tried one. A week later, she had hallucinations. So
Ooh.
it's good that she started early because she had to go to the second drug. All right.
Mm.
So if your drugs are all covered, waiting will help. If you wait, though, then you better be prepared to do the enrollment through your Medicare.gov account online because trying to get on the phone, forget it. I don't even recommend calling the agent of the drug plan because most of that customer service has gone offshore. You're
Uh-huh.
talking to somebody else. So learn how to do it online, have somebody help you with it. It's relatively smooth and easy.
Mhm.
Now, Medicare Advantage plans, with all the changes in the network directory and all of that, they have another 3-month open enrollment starting January 1. January
Mm.
1 to March 31st. I am telling with the network fluctuations, I'm telling my Medicare Advantage clients that maybe after what I see they've got in their situation, they may wait till January
Yeah,
Mm.
makes sense.
because they have a chance. But But Part D people have to be locked into whatever they want by December 7.
Okay.
Sooner
Well,
the
look,
better.
the only last thing that I'm going to chime in before we wrap is just to say that I always like to focus on what's in my control. And after hearing all of this today, especially, and I asked, what can I do about it? I mean, even if it feels like a chore, take the time to review, the Medicare coverage. This is the big message here, and especially the drug plan, because
Do your homework
now,
up
yeah,
front.
yeah.
Whether you're getting into Medicare, the coverage that you're picking, and every year, don't put Medicare on autopilot. Those are my two big tips: homework and autopilot.
Thanks to Terry for writing that 3-part series that's on her website. That we'll have a link to that as well.
Now, I want to just say something. What we haven't said yet is that we've talked about where you get help. And agents, are differently compensated. So, and by the way, we know for a fact they get paid more to put you into an Advantage plan than a supplement. So if you go to an agent, it's like going to, my mother always said, don't go to a surgeon to ask if you should have surgery on your knee or your whatever, because of course they're going to say surgery. If you go to an agent and don't understand, then their compensation dictates that they probably bias towards Advantage plans. Not all of them. There's some really great, honest people. That's number one. Number two, now you know that for Part D drugs, you can go on Medicare.gov or you can go to heymo, HEYMOE.com. But what I haven't told you is what Diane Omdahl does. And I think it's only fair that you've given us all this time. Explain what 65 Incorporated does, because I know you don't sell anything.
Basically, 65 Incorporated, as I mentioned, helps people make smart decisions. We get a lot of people getting into Medicare, they need help deciding what to do, and they are scared. They want help from somebody who doesn't sell. We help quite a few people who are 65 and still working decide, do they want to go in Medicare or keep what they've got? It used to be just keep what you got, but employer plans aren't what they used to be, and you've heard all the issues. So we help them. It's basically one-on-one consultations. We handle quite a few of. Just people call us when they're in Medicare and they've got a totally different problem. I'm a registered nurse and I have worked long-term care and home health care, and I have helped people with a lot of dilemmas. They don't know where to start. Now, that's something we don't advertise, but we kind of fall into that. We do the open enrollment consultations. I work with clients directly, and then we have HeyMo that people can do that. So we are doing everything we can to help people do their homework.
It's not easy. And by the way, we're talking about seniors. It's also not fair. I mean, we got a pretty savvy group, not only sitting here on the table, but all of you out there listening, because you took the time to listen to this whole podcast.
Yes.
I want to say again that at terrysavage.com, there's a 3-part series that Diane has vetted. If you post questions on Ask Terry and I can't give you the answer, I'm calling Diane, and she's been very great about that. You can also get her book. And we'll have all of that links on the show notes. And we're going to put your podcast up on terrysavage.com, so we'll have a link to it there. Thank you very, very much to everybody. Don't be scared. Do something. Start now. You've got till December 7th. At least review your drug plan, review your Advantage plan, and make sure your doctor's still in there. You do have another choice of deal with that in January, February, and March for Advantage. And then be very careful before you say, I'm getting out of Advantage, switching back to traditional. Make sure first that you will qualify for a supplement that will make it worthwhile.
Right. And thank you for your guidance.
Well, this was a marathon. Thanks, everybody.
Yes.
Happy open enrollment.
Happy open enrollment.
And a healthy new year.
Or maybe I'll second that. All right. Bye now.
Bye, everybody. Friends Talk Money is funded in part by a grant from the Investor Protection Trust. The IPT is a nonprofit organization devoted to investor education. Since 1993, the IPT has worked with the states to provide the independent, objective investor education needed by all Americans to make informed investment decisions. Visit investorprotection.org. We also receive support from the North American Securities Administrators Association, known as NASA. It's the oldest international investor protection organization. NASA's members include state and provincial securities regulators from the U.S., Canada, and Mexico who serve on the front lines of investor protection. Recognizing that education and awareness are powerful tools in the fight against investment fraud, NASA is pleased to sponsor Friends Talk Money. Here are 3 important tips to help you protect your money from fraud. With investing, there are always risks, so be cautious of anybody telling you that a certain investment is guaranteed. You should also proceed with caution if somebody is promising very large investment returns. This is a common red flag for investment fraud. Last and most importantly, be sure you're working with a licensed or registered financial professional. You can check your advisor and make sure they're licensed by visiting brokercheck.finra.org. NASA is your partner in keeping you safe and helping you avoid investment frauds. Visit nasa.org and click on the Investor Education tab to learn more.